We're lucky today to have two awesome people who have built multi-billion dollars of equity and enterprise value of amazing companies. On the far side here, Clint Phillips. Clint is now running a company called Medici, which is similar to the Cafe Medici, but pronounced differently. We're going to hear about that. That is a newer healthcare venture that he's building. We'll hear about a serial healthcare entrepreneur, sold a business for $500 million in telehealth, and he's the man. Julia, to my left on the middle here, is the CEO founder of EverlyWell, and has been at that mission for a decade now in Austin. And so to this topic, let's just dive right in. When you hear the leading thinkers here talking about movements in consumer health, you guys have been on the front lines actually acquiring customers. What do you guys make of finally everyone is waking up to this thing? Let's start with you, Julia.
Well, you get the first woman up here, and then I get a windstorm in my hair, so I'll take it. I'm really happy to be here. Listen, many companies have tried to tackle the how do we get people actually engaged in their healthcare and changing it for decades. We started about a decade ago getting people to want to care about their health problems and symptoms that they couldn't find doctors to care about, and so they would go to the internet and try to find solutions themselves. And so we came in to say, how can we help reinvent how you can get a lab test that means something when you can't get any answers from your doctor? That largely was women. So we started with a group of women that would be motivated to do that. But of course, 23andMe came before us. And we had millions of Americans spitting into a test tube to send it in somewhere to fundamentally change a behavior and learn something new about their health. And so that was a good precursor for then my business. And that was really how we were able to tap into, at the time, people feeling ignored, people not feeling heard, women feeling like they would spend lots of money and be told that, oh, this is just like kind of what happens. And so we tapped into that very specific emotion, which then I think can really help drive consumer action. But it remains, a core group of customers that have a problem to solve. And then I know we'll talk about this, but it gets much more difficult when you're trying to get people to engage on a health problem that is something going to happen in the future to them, on prevention, on anything that is not an immediate issue for them today that's making them feel badly.
Well, are you already seeing what maybe literally in your customer acquisition cost, or maybe the phenotype of the types of customers? Do you find people that are reading these tens of millions of books being sold by Callie and by Mark? Is that a different kind of customer that's coming to EverlyWell? What are you seeing there on the customer side? No,
that's absolutely the same customer that we're serving. And it's EverlyWell has really become something that is for people looking for, on the consumer side, if you go online, people looking for a specific solution for their health. Not as much in Mark and Casey's books, but the other big part of our business for consumers is STI testing. Major epidemic, untreated, people still getting stigma, and so that actually has become a big portion of the business that we are doing at home and then helping people get treatment for. But one of the interesting things that we've seen happen is our business has diverged in the sense that we have one platform for getting tested and for getting treatment, but we now have a significant portion of our customers that are the engaged health revolution group, right? This is the people who have read all of Mark's books and who have been engaged for a very long time. The other part of our business, that is now the larger part of our business, is people who have never once interacted with their health system or their doctor or their health plan, and we send them free health care. And they use that, and it is paid for by their Medicare and Medicaid plans. Wow. Now, that, of course, is a totally different, no one in this event is part of that group. These are people that don't want to go to the doctor, have never been, have multiple co-conditions, and we are their first entry point into getting tested for diabetes, for cholesterol, for kidney disease, for colon cancer, and they're using the same platform and the same products, and that's been a really, really big unlock for us over the last 5 years or so, post-COVID, and has transformed, I think, how we're able to think about impacting consumer health.
And that's something I want to spend some time on, is kind of some version of crossing the chasm from some of the elite biohackers to the mainstream, and a big piece of that is who is paying for it. Clint, tell us about the business that you've built and how you intersect this topic of sort of the early adopters with the vision to getting to the mainstream.
Yeah, I was trained as a chiropractor in South Africa. Hello, beautiful people back there. It's lovely to see so many healthy-looking people coming together to learn about health. Evan, thanks for this opportunity. So it's amazing to see people get fired up about this. For me, trained in South Africa, holistic was all we knew. So we never learned the name of one drug. So I came out of education with 100 ways to help people, and not one of them was a medication. So I come over to Aspen. I'm working at the St. Regis Hotel. We open a clinic to help people avoid pain and get out of pain. And they would list all the things they were on. 1, 2, 3, 4, 5, 6, like 15 drugs. And I would just like go, I wouldn't even know how to spell them. I don't know what they did. And I'm like, but I got an idea for you. I'm going to start you moving. I'm going to change a few things about your diet. I'm going to help you just understand the stress impact. And they'd start to get better. And they go, this is like voodoo. This was the simplest, most basic stuff. So I've been really excited to see doctors now, Mark Hyman, Casey Means, really just bringing, they coming around to what to us was obvious. They have to almost unlearn their education, which we were given. I was thrown into specialty healthcare when my little girl had a stroke in Aspen after a hepatitis B vaccination. And we learned, like, what do we do now? Like, this is beyond, I don't know that physical therapy can help this. So we got thrown into medicine, and we figured out that we had to find ways to be able to solve the consumer challenge, because we didn't know what to do. And information was locked up in these doctors' minds behind wall after wall after wall. And after all the waiting lists, we solved that. Today, we are really excited that consumer-like information, there'll be a handout with a QR code where people here can scan their face and know the condition of their health today. 30-second scan, download the app, the QR codes are on the tables, and you'll be able to know the condition of your health by just looking at the blood flow under your skin. It's wild. I showed it to some celebrities, and LeBron James and Dr. Dre and all these guys invested because they'd never seen somebody make it easy to get health information. Now, it's not the detail that Julia can bring through deeper testing, but we also can connect that to an AI that can answer every medical question you've ever wanted it to know. And it's taken Mark Hyman's brain, don't tell him, it's taken all the great preventative brains and put it together and made it accessible for moms and dads and families to have information.
I want to make sure the audience sort of understands the real products and services you guys are built, because they're so interesting. One of the things I've loved in playing around with your and a few other of these chatbots is I find to sit and listen to a 4-hour Huberman podcast, I'm just like, Uncle, let me out of this thing. And then you get your blood work back, and it's 40 pages long with some things are red, and they're like, oh, the red doesn't matter. Other things are green. They're like, it shouldn't be green. It's very hard to understand this stuff. So I think a LLM trained on this information and your own data is super powerful. So Clint, why don't you tell us what you've built and what are the opportunities for the AI chatbot to invite people into this?
Yes, we've made it easy for our AI. It's called Dr. Gabby, after my daughter. And Dr. Gabby can scan your face and give you insights. She can scan 1 million products and tell you what's in and all those things that we should worry about. You don't have to worry because it says this is an 84 out of 100 and here's why. It can even personalize it to what we found on your face. So if we found you've got a very high risk of cholesterol, it'll say this product is worse for you than it is for Julia, depending on yours. Lastly, you can just scan your medical result, take the photo, and Dr. Gabby will explain it to you in 11th grade English, where you can go, I actually understand what I'm learning. So that's the beauty of being able to take an AI and be able to have it trained to be simple, to be preventative, to be caring. My wife, who never really cared about what we were doing, sat the other day for 3 hours with Dr. Gabby taking notes because she's sick and tired of menopause. And she's like, I have to understand this all the way. And she sat there for 3 hours asking questions and came away and said, I could never have got that information because I wouldn't have ever got to the doctor or wanted to burden a doctor for that long, and I'm not sure they would have known all the questions I asked.
Yeah, and talk a little bit about business model. Is it insurance pay, cash pay?
You know, I'm such a fan of Julia. This is an incredible entrepreneur, and she has learned how to work within the medical system and get things paid into Medicare and Medicaid. I've been on the outside. I've got corporations to pay. My next step is convincing consumers to pay. similar to Function, congratulations to Function Health, we're going to see what type of tolerance a person will pay for an AI that can be a doctor. And we hope that payers and things will pay in the future, but right now we are convinced that we have to have moms be able to understand the value and use it and create value to them before we can get government to pay.
Yeah. Maybe tell us about the product and your evolution from self-pay to insurance.
Yeah, absolutely. I mean, listen, the food revolution is led by the moms. The current consumer healthcare revolution is led by the moms. The AI healthcare revolution will be led by the moms. So it is the core audience, and it is the audience that is solving these problems for our kids. And so obviously we were built for moms, for women from 25 to 45. The first comprehensive at-home testing and treatment. We're the #1 at-home testing brand in the country, and have remained that for about the last 8 years. And ultimately you get to a point though where people won't pay for basic health services when you get beyond a certain million number of people. And so then you have to say, okay, how are we going to actually change healthcare for 100 million people in this country? And of course that does need to be done through policy, through coalition, through actions of the government, et cetera. But what we did is we found a way to say, hey, can insurance actually pay for this? And can we make it free for the sickest people in the country? For diabetics, for people that have multiple co-conditions, of course, obesity, diabetes, kidney disease. And can we actually get those people to talk to us? Will they respond to a text message or an email? They've never once interacted with their health insurance, ever. And that was a really fun challenge, and it's one that is in the future going to be driven by AI, is currently driven by deep data analytics, predictive modeling, those kind of things. But we can go to a health plan and say, give us the non-respondents, the sickest people that you have that have never once engaged, and we will get them to get a diagnostic test, and we will get them into follow-up care, and we will actually get them to go to that doctor's appointment. And of course, the health plans will say, if you can actually do that, we will pay you a lot of money for that. And they don't charge these members a dime. So that's been part of it. But look, AI, the health plans are a long way. The rest of America, right? The actual rest of the country that needs healthcare and has to be insured is a long way from using AI. And so you have to bridge through consumers first. That's going to drive what Clint is talking about. Consumers will end up driving that into the health plans.
And talk a little bit about what's at stake here. A lot of us are sort of biohackers, exercising and getting the extra little sleeps. Your HRV goes from like 62 to like 64. But these patients that have never talked to a doctor before, give us a little snapshot. What are some of their stories, and how can you intervene?
I mean, these are individuals who are over 350 to 400 pounds, who have toxic levels of certain biomarkers that sometimes we get on the phone. We have our doctors who will stay on the phone and call the police and call the hospital and send an ambulance. We all the time, multiple times a month, our doctors are staying on the phone with the patient because they have a blood test result that is so dangerous that in the next 24 to 48 hours, if they are not treated, they are going to die.
What is in their body?
I knew you were going to ask me that, and I'm not the doctor. You're the doctor. Toxic diabetes.
I don't know. Is the A1C off the chart?
It's a different marker. And this is, by the way, this is on behalf of Quest. We are working on behalf of Quest, and we are doing the testing at home, and then we are saying, okay, we're going to call you and get an ambulance to your house. And so, this is the level of care that has to be delivered to actually help people in these food deserts, healthcare deserts, socioeconomic areas that need more health support. And so this is the reality, I think, of when you talk about scaling healthcare beyond the biohacker crew, which, by the way, is still important. But this is what it takes to then make it accessible for everybody else because the country is so sick.
Gosh, I mean, to think about, it would be great. I'd love to have more of these people think about moving, sort of crossing that chasm from the elites to the masses, because you hear some of the generalized statistics about diabetes, about obesity, and you're sort of like, well, I don't really know anyone like that. I mean, if you travel in these elite circles, you just don't have a sense of, if you are in a food desert and you're 300 pounds and you're a diabetic and your kids see how you eat, you're lethargic, you don't exercise. I mean, there's real structural issues around how we're raising our children in these communities.
Yeah. Hugely structural issues, lots of education issues, lots of fear, oftentimes supported fear of how people have been treated in the past. And so it is a major challenge, and yet we still are running a business, and we can't be the entire kind of safety net for these patients. And so that's why we say, hey, who can pay for this? Which is the health insurance plans, because they actually, they want to make money, and it's better for them if they have people get these metrics, and then we can treat them.
Let's talk a little bit about behavior change. So both of you guys give information to users, hopefully jostling us, oh my gosh, these levels are off or should be in these ways. Maybe Clint, start with a little bit of, once you freak them out, how do you usher them into better decision making or interventions?
Yeah. For anybody I meet afterwards, I'm going to give you a quick pop quiz. 5 things. There's 5 things that make doctors today in America quite useless. And if there's any doctors here, I'm sorry, I'm sure you don't fit into this category. But the 5 things are, firstly, doctors don't understand prevention. So they've spent no time learning, training prevention, and we make it required reading for our 40 doctors to read Good Energy, to read Super Immunity, to read these books, because they don't understand prevention. The second is behavior change. Doctors have completely given up on the ability to change behavior. They just say, not my job, I don't think it's possible. They write the script. The personal trainer believes that behavior change is possible. The yoga instructor believes you can change behavior, but the doctor's like, can't change behavior, really sorry, just give them another script, and it's nonsense. Number 3 is DNA. Our DNA shows that every single one of us are different. Caffeine lowers my blood pressure 10 to 15 points. It's amazing. For some of you here, caffeine does the exact opposite. Unless you really understand your DNA, you're practicing in the dark. Lastly, doctors don't use AI. So they aren't understanding that I can't remember this. Medical knowledge is doubling every year, every 2 years. How's a doctor supposed to keep up? They think it's below them or, wrong for them to actually trust technology to be able to use it. So we feel docs are really not prepared, and the behavior change part has been so disappointing because they're not even trying, and behavior change is fundamental, even if it's the smaller behavior change. The most simple one we do with people is if we know they need to exercise, instead of saying exercise for 1 week, our health coach texts them every day and says, did you put your shoes at the door? Did you put your shoes at the door every morning? And they get in the habit of putting their walking shoes at the door. Step number 1. Step number 2 is put on the shoes and walk around. Just walk around. Baby changes, the smallest little dietary change, you can absolutely change behavior, but it takes some desire, some training, some effort.
Another piece of this, talking to Brian Johnson a little bit, one of his next interest areas is how do you really create little communities around the Don't Die community, how to peer groups, peer circles, create some accountability, your walking buddy, et cetera. But it really is hard. Clearly, 5 minutes with your GP who says, yeah, you really should lose some weight is not moving the needle.
Especially if your GP's 25 pounds overweight and they say, hey, you should walk a little more. And people are thinking, you don't look that healthy, doctor. I think I look healthier than you, doc. So it's really, not to just beat up on the doctors, but it's a problem.
Or they've been going to those steak dinners with pharma. It puts on the weight. So how does EverlyWell intersect with behavior change?
Yeah, look, this is ultimately about incentives, as everything tends to be. Even if doctors try and want to not be subject to these incentives, they are paid by insurance in 15-minute increments. They don't have enough time to properly treat, and they're being pushed to these time brackets, and they're overloaded, and we have a tremendous primary care physician shortage. And so they go to what is easiest and is going to affect the change, because all of the systems pieces are stacked against them to do what Clint has been able to build in his company, right? Which is this very, very different form of medicine. And so you have to be able to change the behavior by, frankly, using incentives. And so what we do is we say, you get a free health service. In some cases, you might get a gift card if you use that health service.
That's
right?
Good.
You get an Amazon gift card. People are motivated by beauty, by consumerism, by feeling good, by sex, all of those things. We see what Hims has done. We look at what they have sold. That is a vanity company that has done very well selling vanity medication and vanity products. And how do you make people care in the same way about their A1C? You have to be able to give them some of these type of like feel-good dopamine immediate incentives, like a gift card. And we all operate the same way. These are the same people and how we change our own behavior. We just have different systems in how we incentivize.
We were at this thing that Jim Breyer put together the other day, and I think the new head of product at Lilly was a head of product from Apple. And he was talking about how can you design pharmaceuticals to be like really exciting product experiences with like really sexy labels and really exciting marketing. And so I was sort of like, this sounds horrible. I wish you didn't work there. I wish it was somehow illegal for you. But what you're talking about is how do you incentivize and create a great experience for people to make choices that lead them to be healthier, not to consume more pharma.
Exactly, and that's coming from what Hims has been able to achieve. And let's talk about the good part of Hims, which is they have shown consumers will pay. And so it is important to acknowledge that, and they've executed very well. But yeah, it's beautifully branded, right? And so you're seeing a lot of the pharma companies move that direction, and it's going to work very well for them. Yeah, look at Lilly Direct for GLPs.
Yeah, huge. This panel sort of is talking about the challenges of scale. Remind us a little bit about your business right now. Give us some metrics of sort of how's the growth look like and what have been some challenges of the scale.
Yeah, so over the last decade, I started the business here 10 years ago. We have served 60 million Americans across all of our channels, which is a tremendous number of people. We, last year in 2024, 1 out of 86 US homes had one of our test kits in it. And our brand, again, is the number one home testing brand in the US. I think, though, what has been so helpful and a massive shift in the last year has been the unlock of a lot of the, what I would call institutionalized, structured diagnostic and pharma companies actually wanting to say, if we don't get on board with these digital models and serving consumers, we are going to be disrupted. And it's taken probably 20 years for them to get there. This can be Quest, LabCorp. Ideally, the pharma companies are able to find a way forward that is not just pushing all these medications on people. But it has been very interesting to watch because they are coming to companies like ours and saying, hey, we want to deliver different menopause care. We want to deliver different integrated virtual care. How do we do that? And it almost feels like a reaction to this movement that we're seeing. I also heard Mark mention the food as medicine play. There's probably 10 companies I can think of that have raised tons of money around insurance reimbursed nutrition plans, like Berry Health, et cetera. And so for us, that's really where we're focused, is how can we grow by working with these large players, but still staying true to our core mission, which is getting people to take positive actions that's grounded in actual data for their health.
Quick question on Quest. I know Function and a few other placer organizations, companies are sort of coordinating the back-end testing, making it more accessible, rolling up the data. Like, does Quest eventually get disintermediated? Is actually running the tests themselves complicated? What happens to Quest?
So Quest and LabCorp have been clients of ours for about a decade, and we are the back-end physician and technology infrastructure for their direct-to-consumer laboratory platforms, which they have. So if you don't know, like Function, you can get on their websites and go buy testing and book your own appointment, cash pay. I don't think so, because what Quest and LabCorp have realized, as have places like CVS and Walgreens, is their brick-and-mortar centers are the key to that business, and it's their most important asset. I think every American lives within about 30 miles of a Quest. And so until there are massive technology innovations, which there's many companies working on putting blood testing machines directly in your home now, many well-funded companies, until that happens, there will be a necessary reliance on this kind of brick and mortar system.
Clint, you built a huge telehealth company, sold it, you're back at the beginning. What's on your mind about this next path to scale?
Julia mentioned the shortage of primary care doctors. I think we can really solve that. I think we can help doctors get back to things that doctors can do, like put their arms around you, model good behavior, help you understand these transitions in your life. So I think we're going to solve the doctor shortage. We launch May 1st, so you've got an early version of the app today. It'll be significantly remodeled for May 1st, and Julia did commit today to advise us, so I'm excited about that. I'm holding you to that, hey?
I got a title now. I love it. Great.
And before we've even launched, the country of Uganda called us and said, hey, could we access that health information for the country of Uganda through WhatsApp? So you think of the ability to really deliver change to 1 billion people, like that feels like it's possible. And to, be able to help the least, who are struggling the most in those areas, I think it feels like it's the Wild West. And it's really, really exciting to see just where the gold is and how we can change as many lives as possible.
Well, hey, maybe to bring us home, I'm super excited to be in Austinite. I think 80% plus of people here today live in Austin, which is kind of crazy. Reflect a little bit on you guys are so core to building this ecosystem. What are your thoughts on Austin in the health and wellness space, and where could we go?
We moved here 9 years ago on the Friday night of South by. We didn't know it was the Friday night of South by. It was very auspicious. We love Austin. I moved here to build this company because I was building a consumer healthcare company and I needed excellent product marketing and consumer goods startup talent. And that was in Austin, Texas. In the last 10 years, though, we have become a health innovation and technology hub. I'm excited about it. So many companies have started here. Several of my ex-employees have started companies in the space here. It is, I would say, the best place to be for healthcare, and it's just an incredible town to build. You have money, you have talent, you have a community of people who wants to help, and I think the future of health tech is here. And it's been really, really fun to watch over the last decade.
Yes, we thought we would build, after we were selling the last business, we thought we would go to the Bay Area, that's where you had to be. And then I realized that Christianity was illegal up there. And so I said, well, what about Austin? And came down to Austin, and Austin has been incredible. We encourage people to start businesses. Meeting Julia in the early days was wonderful, to meet a fellow digital healthcare entrepreneur trying to make a massive difference for tens of millions of people, and she's done it. So it's just amazing to be part of it, and I think it's an incredible ecosystem. Hey, especially thanks to you.
Yeah.
You do an incredible job here.
You too.
Arena Hall, Teneo, all the things you do is amazing. So thank you, really.
Hey, bring us home on a fun one. You guys are brilliant builders, leaders, technology innovators. Clint, you had some crazy superhuman feat of strength. Just tell us the story of this crazy thing you did recently.
A few months ago, I decided, after my son challenged me, to break a Guinness World Record. I read through 10,000 records, realized my talents were very limited, but I found one of pushing a car 1 mile. And my daughter ended up breaking the woman. Lance Armstrong came into my life, helped me train, and put a lot of amazing people around me, and said, could somebody ordinary with extraordinary support do the impossible? And we've broken that Guinness World Record, and I bet nobody can break it, because we spent so much money on the science of a car that rolled super smooth. So anyway, very exciting.
Amazing. Well, breaking all kinds of records, including Guinness Book of World Records. Thank you guys both. Congrats on what you're building. Thanks for being here.
Thank you, Evan.